Uh, Good morning, and thank you for coming. I'm New York State Attorney General Eric Schneiderman, and I'm very pleased to be here today at Purchase College with a longtime friend of mine, Tom Schwartz, who's given so much of his time and his talent to making this a great school. We're also joined by Police Chief Michael Bailey to talk about a life-saving public health initiative that our state university is joining as of today. I'd also like to acknowledge some of the students that are with us, Letitia Blackburn, President of the Purchase Student Government Association, as well as Teddy O'Rourke, Jeffrey Weiss, and Jessica DeMarzo, who make up the PSGA Executive Committee. Welcome to you all. We are also very, very pleased to have with us today Bruce McBride, the Commissioner of State University Police, who joins us from Albany along with his deputy, Paul Berger. They have come from Albany because of the significance of the awards that we're making today. One of the major challenges facing communities all across our state, and a particular problem for our college communities, is the epidemic of heroin abuse and the abuse of prescription opioids. We've seen the tragic consequences of that epidemic over and over again. In just the last few months, 2 students at SUNY Oswego died from heroin overdoses. 2 others suffered near fatal overdoses. Last year, a graduate student in the Binghamton campus of SUNY died from a heroin overdose. And we cannot really do much for the families of those students. The agony that they suffered is never going to be undone. And the entire university community suffers when a student dies or has a near-death experience. All New Yorkers grieve with them. But we know that we can do something to prevent further deaths and further overdoses, and today we are taking action on that. The plague of drug addiction knows no boundaries. It is no longer a problem of poor people in inner city communities. It is a problem in well-to-do suburbs, in rich middle class and poor communities across every corner of our state. When school starts up again next week, students all over the state will be living on campuses outside of their parents' supervision, many of them for the first time, and as they test the limits of that freedom, they make choices. Sometimes the choices can put them in danger. It is absolutely a part of the rite of passage of going to college that you experiment, you try different things, you see the world on your own. It's a part of growing up. But students are not adults just yet, and our job is to watch out for them and keep them safe to the degree that we can do so. So as the state's top law enforcement officer, I've worked with my colleagues in law enforcement all across the state to crack down on some of the biggest drug gangs in the state. I believe we've now brought to justice more than 18 major gangs, arresting about 400 people in that, sent major kingpins to prison. But in addition to trying to keep drugs out of our communities, it is also our job to tackle the problem of drugs that have already made it into those communities. And we are able to save people's lives and steer the people whose lives are saved very, very frequently into treatment, because many people who have these near-death experiences get a wake-up call and then are much more open to treatment than they were before that. So this is why our office created the Community Overdose Prevention Program, or COP. We are using forfeiture funds seized from gangs, many drug gangs, to train and equip police officers across the state of New York with an antidote for heroin and prescription overdoses, really an incredible drug called Naloxone that reverses the effects of an overdose immediately. Within a matter of minutes, the opioids are blocked from interfering with your brain mechanisms and stopping you from breathing, which is how you die in a heroin overdose. Today, we are here to announce that the State University of New York is joining the COP program. We are awarding nearly $27,000 that will buy over 250 Naloxone kits for university police on a dozen campuses across the state, including here at Purchase. That means that as of today, nearly half the sworn SUNY police officers are going to have access to Naloxone. So in the event of an overdose, first responders already on the scene will have the tools right at hand to save lives even before an ambulance arrives or someone is able to get to a hospital. We're doing this now in August so that all campuses approved for the life-saving treatment that we were here today, and we have some naloxone kits on the table. We're doing it so they will have the kits on premises when school starts next week, with officers who are trained how to use them before the fall semester really begins. We also have applications pending in my office for several other campuses, so students at other SUNY schools will have this added layer of protection as well. We are traveling around the state, working with our colleagues in local law enforcement. We want every police officer, every patrol officer who thinks that they might possibly be able to use it to have a naloxone kit. In 2011, opioid overdoses killed more than 2,000 people in New York State, and that number was double than the death toll a number of years before. Counties in the Hudson River Valley had the highest per capita heroin hospital admission rate in the state in 2012. Westchester was among the top 10 counties in the state for opioid-related hospitalization. So the problem here is huge, as it is all over the state. And I have to say that one of the things that has struck me as I've been dealing with this problem, and I take great pride in the fact that my office drafted and that I organized the coalition to pass what's called the iStop program to put an end to doctor shopping for prescription opioids, which was a significant factor in people getting hooked on heroin. A lot of people who would never go to a heroin dealer on their own were getting hooked on drugs they were getting from their doctors, and they figured if the doctor gives it to me, how bad can it be? We've put an end to doctor shopping in New York State. We now have to deal with the problem of heroin. And the problem that I find somewhat confounding, which is that the stigma that used to exist about heroin use among young people just doesn't seem to be there anymore. When I was younger, I remember people who were, might be wild people, but they would never go near a heroin dealer, and that stigma has been lost. So when people make that tragic mistake, when there is an overdose, naloxone kits can save their lives. A naloxone kit, as you can see, it's small, it's easy to use, it costs about $60. It used to be the case that naloxone could only be administered intravenously, and that was obviously a problem for police officers in the field. It can now be administered nasally, and each kit contains a dose of naloxone and essentially a nasal inhaler. So you insert this in, put it up someone's nose. Within minutes, the overdose abates and people do not die. They come back to life. They can be brought into a hospital. They can be brought into treatment. It is an amazing innovation in technology. It is a life-saving drug. Since we started the COP program, the United States Attorney General, Eric Holder, has convened a conference to talk to other law enforcement agencies around the country, and I'm proud of the fact that we're serving as a sort of a pilot program here in New York to demonstrate how effective this drug is, and also to save hundreds of lives. Our initial test of naloxone was done in Suffolk County, where more than 170 lives were saved by officers who were equipped with naloxone. 95% of the times in which they used it, it was effective in preventing death, preventing the overdose from having its full consequences. We know it works. We know it works everywhere, and now we're putting this life-saving drug in the hands of campus police all across the state of New York to help stop this plague that is claiming far too many young people's lives. And with that, I thank you, and I thank President Schwartz for his hospitality today and his longtime friendship and commitment to the safety, well-being, and education of young people. And I'd now like to bring him up, the president of Purchase College, Tom Schwartz.
Thank you, General, for that. And I think there are very few of us who have not been touched in our families or among our friends by drugs of one sort or another. And this is an immensely important program, and I thank you. It's an honor for us to have you here today. We've all seen your success in battling these issues, and I think there's a wonderful twist in using money that you've taken in forfeiture cases from drug bans to do this program. So thank you. I know will have a profound impact. Hopefully, we have not yet had the serious problem that some other places have had, but You know, if this were wood, I'd knock on it. And it is the present problem where it seems to have become almost a drug like any other drug. Is a terrible problem. So this 95% is a hell of a rate for saving lives, and we thank you for that. And I know that the deaths that this will avoid will have immense benefit to the families that would otherwise have been so terribly touched. That we have an unwavering commitment on our campus. We have all sorts of programs to deal with drugs and wellness and so forth. But at the end of the day, we're very grateful that Chief Bailey has undertaken this, and it's my pleasure to introduce him to you now.
Morning. On behalf of the New York State University Police here at Purchase, I'd like to first take the opportunity to thank the Attorney General for his efforts to help us and help us in protecting a population that's particularly vulnerable throughout the university system. The Naloxone initiative, as you've seen and you've heard the Attorney General say, saves lives. And some of those lives could be students here, kids, okay, that have either made a really bad decision or may be gripped by the disease of drug abuse themselves. The great thing here is that a lot of times governmental initiatives are talked about and imposed, and they don't come with money. You know, in this case, the Attorney General put his money where his mouth is and said, here's a great way to spend funds that are illegally obtained and put them to good use. So we've been the recipient of some of that money. That money is going to help keep our community safe here. It's going to help keep the communities in New York State safe. And more importantly, that money is going to help save lives. So we really appreciate it, and I thank you again.
Thank you very much. Thanks, Chief. And now, finally, I'd like to bring up the commissioner who supervises all of the state university police of the state of New York and has been a tremendous partner in us getting the word out about naloxone and getting it onto our campuses, Commissioner Bruce McBride.
Thank you. Well, good morning, everyone. I, too, would like to thank the Attorney General for his leadership on this important statewide issue. The issue of heroin overdoses affects both students, faculty, staff, both on and off campus. And it's very important that all police officers in this state have this life-saving tool. It's important also that to recognize that this is part of a statewide program by the State University under the leadership of Chancellor Zemfer for prevention and through education, but also through first response when things go bad. Our job, the State University Police, which is composed of 28 campuses, 600 members, is to save lives. And this will help us save lives. We are the first responders in the SUNY community and realize that the State University is composed of over 400,000 students, both state-operated campuses and community colleges. And I will note that some of our community colleges have taken advantage of this program too. So once again, I thank you for the invitation to appear with you, and we thank you for your leadership in helping the State University Police and the State University of New York.
Thank you very much.
Thank you.
Pleasure. Thank you all very much. And now, if there are any questions, Matt will make you tell them who you are before you ask a question. That's basically seems to be how it works.
You start on the topic of